I said, 3 years ago, the law was passed by Obama, and it's not going to be repealed. So some people still have that misconception that at this point they think it's going to be repealed. It is not going to be repealed, so it's here to stay. So a few things that have happened since then are that the lifetime caps are prohibited. So if you had a plan that was $1 million lifetime limit or a $5 million lifetime limit, that actually has gone away. So your plan is now unlimited coverage, and that's on every plan that's available now. You also can't be canceled. So if you were worried that if you got sick, your insurance company would cancel you, that can't happen. So the only way they could cancel you is if you don't pay your premium. And children with pre-existing conditions can't be denied. So it used to be up until a couple years ago that kids up until under age 18, they could be declined if they had a pre-existing condition and they couldn't get insurance. This is all on individual policies. So now they can't be declined for any reason for any pre-existing condition. They can still be rated up, but they can't actually be declined. Dependents can be covered up to age 26. So that's something that was added, and you know, your child doesn't even have to live with you. They can even be married. As long as they are, you know, under age 26, they can be covered under your health insurance plan. Preventive care is covered with no cost sharing, so that's a nice benefit that was added. This is on every plan, so you have it now. So it includes routine physicals, like well baby visits, an annual GYN exam for women, mammogram, colorectal screening, things like that. So any preventive service is actually free. There's no cost sharing or no deductible on any plan that's available. So what's going to be changing is by 2014, as you've probably heard, and I'm going to go into all of these in more detail, is there's an individual mandate which basically says that everyone has to have insurance or you're going to pay a penalty. There's no medical underwriting at all. So I explained before that kids can't be declined. So come in 2014, adults can't be declined either. So no medical underwriting. The requirement of companies to distribute SBCs, which I'll talk about. Essential benefits, each state is going to have their own list of essential benefits that are going to be covered, which I'll go over in Pennsylvania. W-2 reporting, I don't think will affect anyone here, maybe you. But basically, if you have 250 or more W-2s, you have to include the employer portion of the health benefit cost on the W-2. And women's preventive services, I'll go into more detail, and exchanges are going to be a big hot topic that are coming for January of 2014. So the individual mandate, what this says is that everyone basically has to have insurance or pay a penalty. The penalty in the first year is really not that bad. It's $95 or 1% of your income. But as we go on over time, the penalty is going to get greater and greater and greater. So there really isn't any reason why someone couldn't get insurance, because you can't be declined, and if you are at a certain income level, you could actually get a subsidy from the government. So if you make between 133% and 400% of the federal poverty level, you could actually get a subsidy or a tax credit to buy insurance. If you're over 400%, then you can just buy insurance on the free market like you could today. But it will be a requirement. And then you would have a penalty for dependents as well, which is half the cost of an adult. So if you have a family of 4, your penalty could potentially be, you know, $1,400 for the 2 parents, and then half of that for each kid. So you can see how it could add up quickly and, you know, cost you a couple $1,000 depending on how many kids you have. The summary of benefits is something that employers are going to be required, or actually they are now required to distribute to their employees. And it's basically every carrier has the same uniform summary of coverage. So if you get benefits through your employer, then when your plan renews or changes, they're required to send you this SBC, it's called. And it basically is in very plain language and explains how your plan works, what a deductible is, simple definitions, and things like that. Essential benefits are 10 benefits that must be included in all health plans starting next year. And if they're not included, then it's not going to be a qualified health plan, and you could essentially be fined. So you must have a plan. The company has to offer a plan, or for an individual, have a plan that meets these criteria. So some of the things that are included are ambulatory services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse, behavioral health treatment, prescription drugs, rehabilitative services, lab services, preventive services, disease management, and this is probably a new one, is pediatric services, which includes vision and dental. So most plans today don't cover that. You have to buy a separate dental plan or a separate vision plan for kids. So all plans going forward come January are going to include those benefits. The employer mandate is similar, but it's a little different. Basically, if you're a company that has over 50 full-time employees, and that definition of 50 full-time employees is a little complicated to figure out, but if you have 50 or more full-time employees, you have to offer health insurance to your employees or face a penalty. And the penalties can be very, very steep. They're $2,000 per employee per year. So depending on how many employees you have, and a full-time employee is 30 or more hours per week. So companies that have under 50 full-time employees aren't required to offer it, but their employees have to have it due to the individual mandate. So essentially, what the government wants is that even small employers offer benefits to their employees because it'll just make it a lot easier for in the individual mandate. The medical loss ratio, I don't know if anyone received, like over the summer, a check in the mail from their insurance company and they had no idea why. Did anyone get a check? $100 or something? No, I actually did. Yeah. So what this means is that the insurance companies now are required to spend either 80 cents on the dollar or 85 cents on the dollar, depending on the size of the group, on claims. So they literally have 15 cents left for administrative costs, profit, taxes, fees, broker commissions, overhead, electric bills, stuff like that. So they're very, very lean in their profit margin. So if the insurer ended up spending less than 85% on claims, then the person is entitled to a rebate. So I actually got a check in the mail last summer from my insurance company, and I know a lot of other people did, and a lot of my clients did get checks. A lot of them didn't, but some of them did. So what they had to do with the checks was basically distribute it back out to the employees. So it can either be in the form of a payroll deduction, holiday, or they could use it as a wellness program, but it had to benefit the employees in some way. And that's going to continue. W-2, I already mentioned this, I don't think it affects too many of you, but if you do have over 250 W-2s, then you have to include the cost of the employer portion of the premium on the W-2. That's already in place. So the preventive health care for women, this started last August, so if your plan renewed after August 1st, it already includes this. This is another nice benefit, but very, very expensive, and you'll see why in a minute. So screening for gestational diabetes must be included, HPV testing, counseling and screening on STDs. This is a big one. All FDA-approved contraceptive sterilization procedures and counseling. So that's expensive. Everyone that paid $40 a month for birth control pills or whatever are now free. Lactation support and equipment rental. So to rent a breast pump is like $300. It's now supposed to be free. And screening and counseling for domestic violence is included, and one annual GYN exam a year. So some of these things were already included by most carriers, like especially the annual exam and the screening for gestational diabetes. They would be included in your prior coverage. But now going forward, whenever your plan renewed beginning August 1st, all of these benefits have to be included. So the two high-ticket ones, obviously, are the FDA-approved contraceptives and the lactation equipment. Exchanges. Everyone's talking about exchanges. I feel like that's all I hear about is exchanges, and I'm on webinars like 3 times a day learning about exchanges. So each state basically had the option of whether they wanted to do a state-based exchange or a federal exchange, or if they wanted to do a partnership exchange, which they don't even really know what that means yet, but it's some kind of partnership between a state and the federal, where the federal basically runs the program, but the state is able to administer it to some extent and make some calls on what plans are available. Pennsylvania has a federal exchange, so they opted to not go with the state-based model. Same with New Jersey, and Delaware is a partnership model. But a lot of the other surrounding states have their own state-based exchange, like Maryland, New York, Connecticut. Some of the other New England states, Massachusetts, all have their own state-based exchange. So basically what an exchange is going to be available starting October 1st, where individuals can go online and put their information in. It's a 21-page application. They're saying it's going to take between 45 minutes and 2 hours to complete. probably more like 2 hours, probably similar to applying for Social Security benefits. And it's like an online marketplace where you can go and see if you qualify for a subsidy. So if you make under 400% of the federal poverty level, which for a family of 4 is $92,000, single person is $45,000 or so in 2012. You would be able to, basically shop for insurance online. And you can technically do that today, but you can't get a subsidy today. So starting, this would all be effective January 1st, and the plans will be available through the exchange come October 1st. So the initial open enrollment period for next year is going to be October 1st through March 31st. But going forward after that, it's just going to be around October 7th to December 7th. It's going to be a much shorter window after 2013. So it's kind of like a Travelocity or an Orbitz where you like put in all your information, where you're coming from, where you want to go, and it'll bring up all the different plans that are available in every carrier that's available in the state. So each carrier has to offer, if they want to participate, 4 plans. They're called Bronze, Silver, Gold, and Platinum, and they each represent different percentages that are basically equate to what the actuarial value of the coverage is. So a 60% plan is a bronze plan. And that means it's going to typically cover 60% of all your medical expenses, and that's going to be the cheapest plan you could buy on an exchange. You could probably buy other plans on your own outside of an exchange through a private market. So the silver plan is going to be a 70% coverage, gold is 80%, and then platinum is 90%. So if you're used to a really rich plan and you want to continue with that, you would look for a platinum type of plan. So the exchanges are evolving every single day. It's costing billions of dollars to put these things in place. So the insurance companies have to pay fees to be able to market onto the exchange, but they're expecting 20 million people to enroll through health exchanges in 2014. So it's a lot of people coming on board. So I guess the insurance companies are looking like it's a huge opportunity to gain new members. And that's pretty much it. The Pennsylvania website is a really, really useful website, insurance.pa.gov. And healthcare.gov is also another one. That's my website, getmeahealthplan.com, and you can find me on LinkedIn and Twitter. I post healthcare reform updates every day on my LinkedIn page and almost always on Twitter. So if as I get them, I send them out. It's constant updating of information. So I also have my brochure here, which gives you a little bit more information about me. So basically my company is, as I mentioned, an employee benefits brokerage firm. So most of my clients have under 50 employees. And what I do is I go out and help the employers design benefit programs for their employees, and then I educate the employees on those plans. So it's one thing to offer benefits, but another thing to really engage your employees and let them know what you're paying for. And going forward with the new health reform laws, employers aren't going to be required to contribute as much as they do today. Right now, the insurance companies require that you contribute 50% of the cost of the single person. Going forward, you're actually only going to have to contribute 9.5% of the lowest person's salary. So it could be a lot less expensive for employers to offer benefits. So as long as you offer a decent plan that has 60% actuarial value and it doesn't cost your employees more than 9.5% of their adjusted income, then you won't be fined as an employer. Question?
The watchdog of all this is the IRS?
Yep, IRS, HHS, there's like a lot of different departments involved.
So if an employer doesn't comply?
Yep. Yeah, and the employer has to certify that they offered a plan that meets the 60% level and that it doesn't cost the employees more than 9.5% of the lowest employees' earnings. And if they meet those requirements, then the employee can't go out on the exchange and get a subsidy, even if they fall under the 400% of federal poverty level. As long as their employer is meeting those 2 criteria, then the employee cannot get the subsidy even if they're eligible for it, because they have to buy it through their employer.
But only employers that have 50 or more people
Are required.
So like if I've only got 3 employees,
Right.
then I'm not necessarily going to be required.
No, you wouldn't have a penalty. Yeah. All right. The other thing of what I do is I work with individuals and try to help them get insurance. Like if you're not eligible for a group plan, or if you're a sole proprietor and you can't get a group plan, you need 2 or more employees to have a group plan, then through my website, actually, I work with every single carrier in Pennsylvania, New Jersey, Delaware, soon to be New York, Connecticut, and Maryland as well, where you could go on my website, get quotes for different plans, apply online. It's a very, very easy process, and obviously my phone number's on there, so if people have questions, they can call me during the process. I typically talk to people like at least 5 times before they finalize their plan decision. It is, an expensive decision and something that people have to really evaluate before they just jump in. And with the individual plans right now, there's no contract, so if you only need insurance for 3 months, or you buy a plan and then get a job, or employer decides to offer benefits, you can cancel at any time. So it's not like a group plan where you end up getting an annual contract and you can't change plans within that year. If you're in an individual plan, it's a lot more flexible, so you can pretty much do whatever you want.